say I'm an average person with an average result from the experience, how much benefit do I get?
Yeah, so about 20% of people with chronic degenerative arthritic joints are going to see a vast change very quickly. My father-in-law always talks about, he came in, he left, and he swears up and down he didn't have an ounce of pain in his knee that they wanted to operate on, they wanted to replace. He's maybe a 10 to 20% person. The average, we always like to say, based on our talking with people, 50% of people will be 60 to 80% better in 6 to 12 weeks. And then after that, the healing will slowly go down. Around 6 months in, you're going to be where you're going to be. But it's crazy because everyone's different. I've had people super unhappy at 3-4 months. And then all of a sudden we call them at 6 months and they're like, oh yeah, that joint. Yeah, that's better. Right? We hear it. And I think, and I don't know this, right? But one of the things we haven't touched upon is stress, right? Physical, chemical, and emotional stressors. So if we inject them, and this is where it's very difficult because there's many variables. If we inject them and they're going through an emotional stressor, okay, a divorce, a parent died, the kid just got kicked out of college, whatever, an emotional stressor. If they are going through a physical stressor, gluten, dairy, soy, egg, the proteins are creating a load that's just inflaming the heck out of them. This is going to cause an inability to heal. So people are cyclic in how they're dealing with the world. So if we inject somebody and they're just hit with they were just fired after they get injected, their results aren't going to be the same, right? So there's many variables to this. I think that, if they went on a retreat afterwards and chilled out, of course, right, they're going to get better. It's like if we, if you asked me to make your lawn out front of your house look nicer, it was all dirt, and we went and we laid seed down, and you spent the next 6 weeks obsessed with your lawn. You fenced it up and nobody walked on it, and you had a BB gun there and you were shooting the squirrels, right? No one touched it. That lawn will be pretty good. Versus I seed your lawn and you go on vacation and the sun bakes down on it, right? Depends how you treat it. And the human body is the same way. How you treat your body directly affects healing. So, and I have a very interesting story about my dad on what happened. We want to hear that story?
Yeah, please share, for sure.
Everyone loves stories. And I should tell you, I'm a podcast freak. And the last thing I want to hear is someone ramble, but stories are great. All right. So my father played football at UNH in 1967. He tore his shoulder. My father was my gym teacher growing up. And he would always throw sidearm. We would go out and throw the baseball. I'm always throwing the baseball. My grandfather, not his father, but my grandfather on my mother's side played for the Red Sox. So I was always into baseball. So my father's always throwing sidearm, right? So I always knew his shoulder was wrecked. So he was one of my first patients at age 74, 5, I think is what he was. We injected his shoulder and we went paddling down in the mangroves in Naples, Florida, about 6 months later, and he's paddling. And my mom's like, look at your dad. His shoulder doesn't hurt him anymore. And I went over, I paddled over to him. I said, how's your shoulder? And he looked at me like most old guys, like, what's wrong with my shoulder? What do you mean? I said, your shoulder that we injected? Oh yeah, that's better. And off he paddled, right? But again, talking about how you take care of your body, he fell on his shoulder about 1.5 years after in the woods and landed on it. And we haven't been able to help it since then. So again, it's just, here we go. He just tore it too far. And here we are. So everybody's different in their results, but if you take care of your body will take care of you. How's that?
Yeah. What are like the most miraculous transformations you've seen? Tell us a story of what you think is like the number one miracle transformation.
I just had a great story the other day. All right. So I'm in Kauai right now. I was in Maui 5 years ago in a hot tub at a hotel. And there was a man sitting across from me with his wife, and he played professional football. He was beat up. He wasn't healthy. And he said, you look like you're in shape. What do you do? And I told him about the regenerative medicine. So he's been back and forth with us for the last 5 years. He's from Canada. He sent a lot of guys in. This guy is up there in the business world. They fly in on their jet, right? And he revealed to us last year that he was having trouble getting his wife pregnant. 0 sperm count, 0. So we put him through our metabolic program, did some blood tests, but we did an IV infusion. We put 4 cc's in him. What's the date? We did that in December, and within 6 weeks, his sperm count came up, and his wife is 14 weeks pregnant right now, which is pretty rad, right? I mean, that's kind of a cool thing.
That's incredible.
great stories as of late.
I've never heard of that. So there's now evidence of actual sperm count increase from these treatments. Have you heard of that ever before? Or is this a one-off?
Never. And I mean, is it causative or correlative? I don't know if it was like associated with it or if it caused, no one knows. All I know is that this guy had zero sperm count for years, and now he has sperm and he got her pregnant and he's very happy. Another story I've had over the years, actually, people sometimes will ask me, what's the kind of the neater things you've seen happen? And with IV infusion, again, the biggest problem when I talk about IV infusion is that people will say, they're going to help for $100,000. There's people that do this. They'll help your mother with Alzheimer's or dementia, right? And you just can't do that. So we are very cautious when people come in, with different metabolic issues, right? But one of the cool things we've worked with over the years is people that have chronic obstructive pulmonary disease, right? Or disorders, chronic bronchitis, pulmonary fibrosis, emphysema, sarcoidosis, all these things that wreck your life when you can't breathe. So if you infuse, right, these microvesicles into your system, they go right to your lungs. If your lungs are inflamed, and they're going to go right to the alveoli and they target the inflammation in your lungs. And people have had miraculous results with breathing. Again, we don't advertise these things, and we would never say we're going to treat anything, but it's your body. It's a safe way to do this. That's the other thing people always ask, is this dangerous? It's a natural product. If we do everything with clean needles, which we do, this is exactly what we have in you.